Hello, hello. Happy June 1st. Happy Brain Injury Awareness Month. I'm here with my mug from the Brain Injury Society of Toronto. I'll be hosting, or the art is already in my office, so I'll definitely share pictures of that in support of survivors of brain injury. And I decided to come and record a video today. Usually Wednesdays, I go live in the Concussion Rehab Lab Facebook group for clinicians. But I've just been percolating how to engage, how to share information. What is the best way? Social media can be great and it can also be draining. So for those of you on my list, you'll also be getting these videos via email update. If you're finding me organically, hello and happy to have you here. So for those of you who don't know me, I'm Melissa Biscardi, a registered nurse, an osteopathic practitioner, and a PhD student at U of T. My clinical practice and research focuses mostly on concussion, but also COVID long haul and brain optimization. So this past weekend, I did a little workshop and was joined by some passionate, engaging, and amazing clinicians. And we talked about the role of the cervical spine in concussion and in persistent symptoms. So I just wanted to come on here real quick and share a slide that we went over that really talks about the forces needed to sustain a neck injury or cervical injury as compared with those needed for a concussion. And just to give you an idea around that. So this is the slide. Oops, that is not the slide. Here we go. So this is the slide I wanted to go over. Now, research into the amount of force that is needed to cause a injury to the ligaments of the cervical spine, actually was done many years ago in the early 2000s. So there are a couple articles from 2006, maybe 2007. And what they found was that a force of 3.5 to 8 Gs, that is the amount of force required to cause a injury to the neck, specifically at C5, C6. And when forces are transmitted to the head and neck, they can come through the torso or they can actually be directly on the head or the neck, right? There are linear forces and rotational forces, and most injuries involve a combination of the two. So it actually doesn't take a lot of force for an individual to be at risk for a neck injury. On the other hand, the research on the amount of force required for a concussion, that started in around 2006. And what researchers found, so there have been a few studies, and what researchers found that between 75 Gs, so way more, right? Almost 10 times the amount of force, if not more, between 75 and 106 Gs of force is what might be associated with a concussion. So in the study where 75 Gs of force was determined to be the amount of force, actually the percentage of participants who actually sustained a concussion was quite low. I believe it was 5 participants in total. So there is an individual threshold, right? Everyone who gets hit, we know, does not sustain a concussion and does not sustain a concussion to the same severity as maybe the person next to them. And then another study that looked at 106 Gs of force found that that amount of force is associated with around an 80% risk of concussion. But again, it's not guaranteed. And there is that individual threshold, which we know individuals do have varied risk of concussion and of persistent symptoms right? We know that a history of migraine predisposes you for a complicated recovery. We know just being female puts you at increased risk of concussion. We know that being a female in the luteal phase of your menstrual cycle puts you at increased risk of concussion. So there are multiple factors, absolutely. But also there are factors that are related to the actual injury. And what we know is that forces applied to the front of the head, the top of the head, and the back of the head are the ones that are most likely to result in a concussion. So when you're thinking about this, when you're thinking about the forces that are transmitted through the body or directly to the head and the neck, the forces that are required or that are sufficient to result in a neck injury versus a concussion, it's pretty reasonable to come to the conclusion that all concussions likely have a degree of neck injury. So assessment of the neck, rehabilitation of the neck, just exploring the neck as a driver of symptoms is super important. And also this really is an area where manual therapists can shine and really help patients. So if you feel like you need to level up your manual therapy skills or your concussion skills, or even just how you think about rehabilitation of the neck in patients with concussion, feel free to reach out. The cervical workshop happened on the weekend, but you can always purchase the replays if you're very keen. It was an amazing, engaging workshop. And other than that, I will catch you on the next video. Thanks for watching.